Welcome to this fourth video that's going to look at the supporting evidence that's developed within the NIPAD. So in this video we're going to look at what students need to do to develop that evidence and what practice assessors and practice supervisors need to do to authenticate that evidence. It is really important that any evidence, when it's been signed off and authenticated by a practice supervisor or assessor, that it's considered to be complete, to be authentic and to the level that's required. Otherwise it should not be signed off and the student should be requested to redevelop or expand it or start that piece again. So in this supporting evidence we're going to start by looking at the service user care feedback. The service user care feedback was developed with service users and such the questions that are contained within this feedback form have come from them. This is an important part of assessment for the student, but the service user feedback should never be sought from that service user or carer or family member by the student themselves. It should be always sought by a practice supervisor or a practice assessor. The feedback should be anonymous. The student should not be told where that feedback has come from, and that's why it's important that any paperwork is handed out by the practice assessor or supervisor and retrieved by them. Now, in identifying somebody suitable to complete that feedback, that person should be informed that completion is voluntary and will not impact on their care. That if they do consent to provide that feedback, that it will be done in a confidential manner, so their identity will not be made known to the student. The supervisor, practice supervisor, assessor will provide a copy of the documentation and invite the service user or care to complete that. And if they need assistance, then that will be provided by that practice supervisor or assessor. So no identifying details are recorded, and the feedback is used to inform the student's development across the programme. So that once that feedback has been obtained, the practice supervisor or assessor should then sign and date the documentation, and that's to authenticate that yes, this feedback did come from a service user and is therefore authentic. So you'll see then that there is an information sheet that's available for the service user care family member, and it identifies all of those really components within that. And then you'll see on the next page is the actual form itself. So they'll be asked, did the student nurse tell you their name? Did they ask, did they participate in your care? Were they kind and caring? Did they take into account their feelings or choices? Did they listen to you? Did they take account of how you were feeling? Did they check that you understood what was happening? And did they talk with your family or carer where that was appropriate? They can provide some comments on what the student did well and what the student could do differently. And the bottom is where that practice supervisor assessor then makes that confirmation to confirm, yes, this did come from a service user. And they will also confirm that they have discussed this feedback with the student and then sign and date. So when they do have that discussion, they're going to have a set of feedback. So over each part of the program, so out of each of the 3 parts of the program, each student must get 3 sets of service user feedback and have this feedback documented in this way. So the date that it was obtained, the practice supervisor or assessor, and if there was any issue to identify it, and if there was, then has there been a developmental plan devised. And again, the developmental plan explanation of that template is in the additional records video. So then it's signed and dated, and the student will also give a reflection on that service user care feedback. So whether that feedback is positive or negative, the student must record a reflection on it and then sign and date that as well. And that's in addition to any developmental plan if one is required. So 3 sets of clean feedback without issues must be obtained by the time the student undertakes their summative assessment in order to pass that summative assessment, and the template is there for all 3. Now the next set of evidence is around reflective accounts, and there is detail written here to explain what is expected, how reflective evidence can be developed, and what template should be used. So reflective practice is a very important element of nursing practice, and it has the ability to give the student very good insight into their areas for their development, but also for their strengths. Now, there are a set number of proficiencies that have to be addressed through reflection, and there will be a template and a process for that. Now, because there's a number of these proficiencies identified to be addressed, every proficiency does not need an individual reflection. Some of those proficiencies may group together nicely around an issue that the student wishes to reflect upon, and that is okay. However, it would be very unusual to see all of those proficiencies in one reflection. It would have to be an extremely comprehensive reflection. So the important point is that the reflection is meaningful, and that if it covers a number of proficiencies, great, but if it doesn't, that's okay. They'll have the required number of reflections to capture all of those proficiencies, but they don't need an individual reflection for each proficiency. So students should review those proficiencies listed and be aware of needing to reflect on them in practice. So there will be situations that they have observed or been part of in practice that they will be able to base that reflection on. But they may also find that they're coming towards the end of that part of the program or a particular practice learning experience, and the situation has not arisen to reflect upon that deals with the specific proficiency that has to be addressed. In that situation, students should not panic. The important thing is that reflections are authentic. So we do not want anybody making up a reflection just to fit a proficiency. In the situation where nothing has arisen in practice to have that reflection around that issue in the proficiency, then the student can have a conversation with the registrant about the particular proficiency, and they can discuss how that relates to practice, and then the student can use that as the basis of their reflection. However, that's less commonly used, and quite often that's not needed, but it's there as a backup. Now, everybody will have their preference for the template that they will want to use for reflections, and some people will find one reflective model easier to use than another, and that's okay. So we've identified the key ones that are available as being the NMC's revalidation tool. Some will argue that that is not a strong reflective model. However, it is a model used by the NMC in the revalidation process, and so using that may help students to develop their skills in that area. However, the Rolf et al., Gibbs and Johns models are all recognised models with different steps and stages that talk students through the reflective process, and so students will generally find one that they find works for them, and they're all acceptable, as is any other recognised model of reflection. So in completing reflections, students must remember not to use any identifying details. So names, practice learning environments, etc. must not be used. We should not be able to figure out who or what that student or what area that student was reflecting upon. So the identities of people involved must be protected, and it must be a professional but honest reflection. Each reflection must be authenticated by a practice supervisor or assessor. So students need to give the practice supervisor or assessor time to read that reflection so that they can provide verification and feedback. So students should not bundle all of these reflections up and then on the last day hand them over to get signed. They should be handed over as they're being developed so that the practice supervisor or assessor can authenticate them as they go along. Now, for students, it's important to recognise that reflections must not simply be a story. It must follow a reflective model, it must be critical and analytical, and importantly, it must lead to some form of future action. Otherwise, what learning has come from that reflection? So it may be something that you did really well that you want to take forward. It may be something that an area you need to develop in. And then what the student is to use is the reflection completion summary record to track their progress in completing these. And so you'll see the proficiencies are identified, and then there's a summary record where the student can tick off the date of that reflection, who the supervisor or assessor was, and the student then sign. So it means that it's evident to see them progressing as they go along. The reflection template is merely a blank document for students to use to fill in. They can address the proficiency or proficiencies being addressed by number in the top box, and then they can type their reflection in and have it authenticated by a supervisor or assessor. Moving on to the next type of evidence, we have the Promoting Health and Preventing Ill Health worksheet. Now there's a number of these worksheets, and they're designed to address a number of the NMC proficiencies, and this is one of the areas where we take a scaffolding effect across the 3 parts of the programme. So there are generally, most of these worksheets are incrementally built to develop the skills in these proficiencies, and so some more proficiencies will come in as the students progress to different parts of the programme, and the tasks will be increasingly at a higher level of expectation to recognise their development. So in this one you'll see that there's instructions about in consultation with a registrant identifying a person in their care and undertaking a health education episode to meet an identified need. So they will need to use the teaching plan template, which we will come to in this video, and plan out the session first, provide a brief overview of how their health education activity was planned, implemented and evaluated, what factors did they consider in advance of the episode, and reflecting on their experience, provide a brief analytical analysis of the effectiveness of the episode. What knowledge and skills did they use, and reflecting on their development in undertaking this health education episode, they're to evaluate how it will contribute to their future professional practice. So the teaching plan template is provided for them to use, and then they will have a template to complete all of those questions, which will be then authenticated by the practice supervisor, or the practice assessor can also verify it. Care documentation is also a large part of the evidence, and really here we're looking at care documentation that's used in making records in practice. So that could be assessments, risk assessment tools, completing evaluations, making referrals, recording discharge plans, filling out transfer documentation. And that's not an exhaustive list, but that is the type of things that get captured here. So there are quite a number of proficiencies around care documentation as an essential element of nursing practice, where students need to have developed skills. And again, these are incremental across the 3 parts, but listed you'll see all the ones that must be achieved within that part of the programme. And so for this example, this is in part 1. Now there is a guide for what has to be completed. So there must be care documentation, plan of care, care evaluation, risk assessment, and this identifies the proficiencies that are being addressed by undertaking these activities. And these are then get signed off, the date that they completed, this is the record of it, but they actually record not the documentation they completed, but what they learnt from undertaking that component of practice. So that's captured in the learning achievement record. So all of what has to be done up here is captured down in the learning achievement record. And this element of care documentation can be ticked off here, and then the student will summarize their learning and development in completing this care documentation, making explicit reference to the proficiencies that are being addressed. So it's very, very important in doing that they think about things like the ways in which their ideas, their thinking, their knowledge, their understanding and practice have been challenged or changed, or how they overcame any difficulties that they experienced and what they learnt about themselves in the process. They should be able to identify key factors that have enabled them to grow in confidence and competence. They can describe what was learnt from the learning experience and what they might do differently if completing this similar learning experience or task again. So if you're a practice supervisor or assessor and you're looking at this evidence, it needs to be written within that context. It should be about their learning and development, and their guiding kind of questions, key points are there for the student to follow. So in authenticating this evidence, the practice supervisor is verifying first of all that it is person-centered, that the student is thinking and practicing within a context of person-centeredness, that it meets the identified proficiencies, and that it's authentic, so that the student is not reflecting on something that didn't happen, that this was an aspect of care that they did do, and this is an authentic record of their learning and experience from that. So it's important to highlight again that in doing this care documentation, we do not want to see copies of that care documentation for GDPR reasons. What we want to see is the learning that occurred from undertaking that task and completing that documentation. What was the learning, and did it meet those proficiencies that it claims to have met? Now, quality improvement in practice worksheets are, again, very similar to the promoting health ones. And again, these are incremental, and they start in part 1 with looking at audit activity, and that will increase as students go through different parts in terms of the expectation around that. So this really links back to the NMC's proficiencies around quality improvement, and you'll see that these are listed here. So there's 2 proficiencies, one from platform 5 and one for platform 6. And as with all of the other worksheets, what the practice supervisor is authenticating here is that in responding to the questions, that they are authentic and accurate. So again, nothing should be signed off and authenticated unless the practice supervisor is content that what they're seeing is an authentic record of that. The leading and coordinating care episodes are similar. Again, these are around developing those leadership skills, those innovation skills, those skills to analyze practice, lead in practice, and be innovative. So again, these are incremental across the 3 parts, and in part 1 they're largely looking at 2 proficiencies in platform 5, but this is incrementally built. And again, you will see that it has to be authenticated by a practice supervisor or assessor, and again, the practice supervisor assessor must be content that what's there is to the right standard, there's sufficient detail provided, and that they're happy to stand over that the student has done this and that they've met the identified proficiencies. Now, in earlier videos, we identified that there are learning disabilities and children's nursing worksheets that go across the 3 parts, and they vary in which field of practice in terms of being present. So in the adult and in the mental health and in the children's NIPADs, there is a learning disability worksheet, and in the adult mental health and learning disability NIPADs, there is a children's nursing worksheet. So these are partly there to address issues that have arisen in terms of knowing about the other fields of practice to sufficient depth and within the context of the field of practice the student is studying, and also to respond to various reports etc. that have come from practice and government over the years, identifying particular needs to focus on aspects of care. So for example, learning disabilities, looking at the experience of learning disability, people with a learning disability in kind of general healthcare services, has identified that there is deficits there, and so this is one of the ways to try and address those. So these worksheets are set out that they must be achieved across the 3 parts of the program. So there are effectively 3 different worksheets to work through, and we would encourage students to complete these 1 per part across the 3. So their completion is really not assessed until the summative assessment at the end of part 3, at the end of the program. However, it is better to see this being developed incrementally over those 3 parts. So it sets out the task for them to do and provides a template for that, and again is authenticated to say that these are answered with sufficient depth and that they are authentic to the experience that student had. Now obviously the spaces that are provided for each section are not indicative of the volume of information that should be there. Students can access the Word versions of all of these templates, and they can write as much as they want. They will expand as they type. So again, looking at the questions provided, practice supervisors or assessors should be very, very content that those questions are answered, and answered to the depth and expectation that they would have to say that this has authentically been done and is to the right standard. So they're set out in 3 different activities in the Learn Disability worksheet, and that can be done whenever across the 3 years, but we would suggest that 1 activity per part would be a wise way to tackle it. Again, for the child-centered care worksheet, it's the same process, and again it's the same issue. We provided for a template for different aspects of the program. Now, when we come to this record of learning with other healthcare professionals, what we're looking at here is when students go to work with, say, another healthcare professional for a part of the day, a whole day, for longer, they should be able to record the date of that, the location of it, the number of hours, and they should briefly describe the experience and the learning that took place when they were there. So going to work with these other professionals should have a learning focus and purpose, and so the learning should be captured there so that the practice supervisors and assessors in the base area can see what that student undertook and what they learned from it. And whichever healthcare professional they worked with can add their comment, and then they need to verify that with their name, their signature and their designation just on the top line of the form. So again, this template can be expanded out by the students. It's available in Word format should they require it, and it can be duplicated as necessary. And really no student should be going off to do such a learning experience and not coming back and reflecting on the experience and what they learned from it. So the next set of evidence we're going to look at is the communication and relationship management skills. Now these skills are achieved and developed across all parts of the program. So when you see these blue banners over elements of evidence, that means that evidence has to be developed over the 3 parts of the program. It is not considered in the summative assessments for part 1 and 2, but every single component must be achieved when the student gets to the end of part 3 for their summative assessment. Now naturally it is much more preferential that this is achieved on numerous times across the 3 years, so where that's possible, skills should be noted in terms of achievement in each part of the program. And we would encourage practice supervisors to do that, but particularly if they find that there's an area where that student is not achieving and it needs to be highlighted which components they're not achieving, just as much as it needs to be highlighted when they are achieving. So the criteria set out, and then they're scored under achievement in terms of yes and no, and the details of what yes and no means is specified explicitly in the NIPAD handbook. Now what is newer to these 2018 standards is the integration of things like motivational interviewing, solution focused therapy, reminiscence therapy in a more explicit manner, and that's expected across all 4 fields of practice. Now obviously the student will practice at the level relevant to their field of practice, and so in the NIPAD handbook we give exemplars of the actions for the different techniques or interventions listed here, for example, motivational interviewing and what constitutes the steps or the stages that we would expect. So the practice supervisor assessor can cross-reference to that NIPAD handbook to look at that. But again, just to reiterate, these all must be achieved by the end of part 3 of the programme. So the next set of evidence we're going to look at is around health numeracy and calculations of medicines. And again, this is incrementally developed over the parts of the programme. So we don't assume students' abilities around calculations, and we must consider that when students finish their pre-registration programme, that as registrants they should be have the ability to step into prescribing programmes much earlier than what would have been before. And so the NMC proficiencies are built to recognise that, and so this aspect of the evidence is to ensure that these elements are being achieved in practice. That one of the important parts of this is that the calculations that the students are undertaking, it's not just that the student gets the right answer, the student needs to be able to show how they achieved that answer. And that's very important, that they can show their practice supervisor or assessor how they got to that answer. It's very easy maybe to have the right answer for reasons that we can all think of, so it is very important that the student can demonstrate how they got to that answer. We know that a number of serious adverse incidents are around numeracy medications, and so these records are very important. So again, in terms of the evidence being developed, the student has various case studies and things to do, and the supervisor will authenticate that the student has undertaken this work independently, so they have arrived at the answer themselves, and that the supervisors check the answers and confirm that they're correct. So that means that the supervisor knows that this is the student's own work and that they know how to arrive at the right answer. So there's aspects around fluid intake and output, body mass index calculations, and then there are aspects around prescriptions and validity of prescriptions. And then we will see then that there's also the safe administration of medicines administration procedure. So again, there are 2 occasions in part 1 where this has to be completed, and this is where the practice supervisor assessor needs to make sure that all of these elements are being achieved for the student to have achieved in this area. So all the criteria for safe administration is set out, and then the practice supervisor will verify the student did undertake this medication administration under their supervision, and that the above form is accurate in terms of what has been recorded. There's also then the calculations and nursing templates that again are incremental, and it's very important that when this is being used, that the same drug is not being used twice and that all entries must be completed. There is an example of how to complete that for each part of that, and it's very important that in figuring out these calculations that the student is able to show how they arrived at the answer, so they must put in the show calculation element captures that. It's important that students aren't just replicating from part to part the same answers. They should be using new drugs each time in this template, so that they are learning about new medications and the calculations associated with that, and advancing their knowledge rather than just copying from one part of the program to the next. And so that's set out under tablets or capsules, liquids or suspensions, and injections for part 1. And this leads us into the next element of evidence, the nursing procedures. And what we're showing you here is just an excerpt from adult nursing part 1. So what we would have referred to beforehand as being nursing skills is now referred to as nursing procedures, and that's because the NMC don't want us to consider skills in isolation of the whole process of doing that skill. So for example, the approach of the student and the knowledge that surrounds it. So When you see a non-blue heading, so for example we use this yellow colour, straw yellow colour, that indicates that this is part 1 of the programme, then these all have to be achieved within that part of the programme. So the practice learning location, the first practice learning experience of the year, where that is filled in, and then this must be completed on every practice learning experience. It can't be left, it must be completed. And so it's a yes, no, or no opportunity available. If you're ticking a yes, you are saying that the student has demonstrated their achievement in this nursing procedure to the expected standard. If you're saying no, then the student has performed it but has not performed it to the expected standard. And if you're saying no opportunity available, that means that there was no way that you could simulate that procedure or undertake that procedure in that environment, and so it was not possible to make an assessment of the student's abilities in that regard. Simulation, etc. must be considered before no opportunity available is ticked off. So every student will have every one of these procedures assessed for every practice learning experience. Now, in order to achieve a pass at their summative assessment at the end of that part, they must have achieved a yes in all of these nursing procedures by the time of summative assessment. However, if they had achieved, for example, in 1.1, a yes on the first experience, a yes on the second, but a no on the third, then they've lost a skill, and so then they have not achieved in their nursing procedures. The other 2 yeses are cancelled out by a no that comes after them. And so there is an extensive list of nursing procedures that must be achieved in terms of proficiency over each part, but the students have the whole of that part, which is usually a year, to achieve those. That requires forward planning and really thinking it out, but it also means that students should access every opportunity available to achieve these skills, so that they're not in a position of not having some achieved when it comes to their summative assessment. So these are just some of the examples of those. For example, being able to undertake blood pressure, take it accurately, etc., using the sphygmomanometer, and also using the electronic devices as well. Now, in terms of nursing procedures where you see the blue banner, these are procedures that must be achieved across parts 1, 2 and 3. And that's because we recognise that these are not easily accessed, the experiences to achieve the proficiency in these. And so you could not guarantee in a part of a programme the student would get access. So for example, the first one here you'll see is using a cognitive screening assessment tool, such as the Montreal Cognitive Assessment Tool, and that can be used correctly and the score classified correctly. And so there are a number of these, and the student will have their achievement signed off as a yes or no. So there's no opportunity available, because this is done across the 3 parts and they all must be achieved. The registrant can initial it, date it, and then indicate the practice learning environment. In addition to that, we recognise there are some skills that students and procedures that students will become proficient in that have not been set as a requirement by the Nursing and Midwifery Council, but we feel are important to recognise achievement in. So for example, a student may undertake their ILS or equivalent, and they can safely and appropriately undertake defibrillation of cardiac arrest rhythms using the automated external defibrillation mode. And then that can be signed off. They may do endotracheal suction, they may do tracheostomy, stomach care, or change of tracheostomy. So any skills that have been achieved by the student that are not already set out in the nursing procedure records can be added here, so that we can recognise that learning and achievement. Now, if there's no's in this area, it doesn't really matter, because these are not mandatory to be achieved. They're not set by the NMC to be achieved. So really this is a way of recognising additional skills a student has achieved. And that concludes this video on the evidence section of the NIPAD. There's one more section video to watch, and that's the one on assessment.